It's loaded.
Live. Okay, guys, we're doing our live feed again. I want to introduce to you, we're in our wound healing and amputation prevention conference. Early on Saturday morning, people are really waking up. Stop texting me. I'm busy and I'm doing live feeds, so you're interrupting my live feeds. This is Dr. Luis Reyes. He's part of our team. He's a very seasoned surgeon here in McAllen. He's going to discuss with us today wound healing and obesity. We know we have an epidemic of obesity throughout our country. We are a country of large portions and overindulging because we are the United States. We love to overindulge. But it's very important that we understand how obesity plays a negative role, not only in wound healing, but in wound development. Dr. Reyes, we're live and you really have the world watching. So tell us a little bit about what you see, why you got involved in obesity surgery, and then we're gonna do your actual presentation. But what do you see with the obese community and development of wounds or wounds not healing? We've had cases where the sole factor of patient deterioration is like, you're healing this and now she's got this, and then you're healing that and now he's got that, and it's just a snowball effect. And we've had patients, Dr. Reyes, that are completely covered in wounds, and obesity was the key factor of why the patient can't heal. You can't heal when you have this much adipose tissue. Adipose tissue doesn't granulate. So there's a reason why we need to cover this. It's very, very important, Dr. Reyes. Tell us a little bit about yourself, how long you've been in the community, where your clinic is, and then tell us why it's important to cover obesity and wounds and wound healing, and then we'll go into your presentation.
Well, thank you very much. Thanks for having me here today to share some of the thoughts that I work with every day. And yes, I got involved with obesity because there's a lack of knowledge, education, not only with the patients, but even with the doctors in communities, where this is a problem that happens every day, hinders our possibility to become healthier in every single aspect of life. And today, we're going to be talking a little bit about the wound healing part of this course. The arterial, the limb savage part is not for me to discuss today, even though, as April said, I'm part of their team where we are trying to heal, not to amputate. Unfortunately, yes, I am the one who has to do the amputations every now and then. And that is because one of the main problems of obesity, which we're going to talk, is the lifestyle, the way we live our lives. But obesity is just a warning sign. The fact that we are overweight doesn't mean that we are the only ones that are sick, because most of the amputations that I perform are in thin individuals. That's the term TOFI. Thin from the outside, but fat from the inside.
Let's repeat that. I want the community to understand this, okay? TOFI, thin from the outside, but fat from the inside. Explain that to us, Dr. Reyes. We're learning, you guys are learning. What is that, and what do you see, and why does it impact?
Well, in simple terms, we all have that brother, sister, cousin that is thin and eats everything they want and don't increase weight ever. And we go and we eat 2 or 3 things, and we're always dieting and having problems with the weight. Well, that's because of metabolism, that's because of many things, but that thin person that eats everything and feels comfortable eating everything does not mean that he's healthy. And is going to die the same as the obese person. And it's worse because the obese person at least has the warning. I'm overweight, I need to do something, or something is going to happen to me. The thin person doesn't have that. Oh no, I can eat everything and nothing happens to me. Chicharrón, tamales, cake, and everything. Well, and there's the amputations. There's where not even April, Dr. Farias, or Dr. Quintana can help. Because everything has to come together, as she said. We are very lucky here in our community to work with extraordinary nurses, physical therapists, pharmacists, doctors, extended care facility people, industry that partners with us with the things that we need for our patients. But we need all to work together and get everything, because one single aspect is not going to help with these major problems that we see in our community. So the part center west, 25 to 30%. Some few areas, California, 30 to 35%, but look at the red areas. These are areas where most people are now going to 40% obesity. This is a huge problem in the United States. Needless to say, our area is really bad. So in 2013 and 2014, McAllen was voted the fattest city in the United States.
Let's say that we're live. Can everybody see this, guys? Doctor, did you say that McAllen was voted the fattest city in the United States?
Yes.
Okay, mental note.
And this is a national poll, so we unfortunately were in the news, but not for the best of our abilities here in McAllen. The problem also is that in the United States, the epidemic is just huge. Now, we always say obesity, but wait a second, there's different degrees. There's the overweight, there's the mildly obese, or the moderate obese, or the morbidly obese, and there is the super obese. And if we see just here by millions, you know, somebody that is just overweight, 74 million Americans are overweight. 62 million Americans are in the obese category. And morbidly obese are 17.6 million Americans. I mean, the problem is huge, is in the millions.
Doctor, I want you to tell us, because, guys, I'm sorry, but in our culture, doctor, we think that, for example, I am very healthy. I have a BMI of 30. I am obese. Understand that. Being a little thick is not healthy. And I want us to understand that the BMI actually matters, right, Dr. Reyes?
Yes, the BMI, even though it's still not the perfect measure, it's a better measure than just going to the scale and see what's my weight. The BMI takes into consideration my weight and my height. And those two together are giving me a much better
But Dr. Reyes, what about the patient that tells you, Dr. Reyes, look at me, I look really good. I'm Latina, I'm supposed to look like this, right? Right? Come on. So what do you say to that patient? Why is height and weight important for us to address?
This is all about health. Looking good is one thing, and then being healthy and alive is another thing.
Yes, sir.
I always tell my students, I have a couple here in the back, is old people don't get to live long. And just look outside, go to the mall. Are the senior people that you see in the mall obese? No, because there's no obese viejitos.
They look like Mr. Printy and his lovely lady.
Yeah, well,
look at her. I want to be like you when I grow up.
She's
healthy.
Can tell you, you don't see obese elderly patients out there because they're not there anymore. They're dead.
Right.
They're gone.
Right.
And that's what sometimes we don't understand, that this is not about how I look. It's about my metabolism,
Thank you,
my
doctor.
health. This is all about health. So, unfortunately, being overweight or obese comes with a lot of problems. And yes, you hear a lot about the economical problems, 4,000 deaths per year and $140 billion of cost because of being overweight. But really what we sometimes don't understand is that you may look good and you may not feel bad, but it is just a matter of time, or you're living in a very fine line where anything is gonna drop your well-being very quick. So there's pulmonary problems because there's so much in my cage, in my abdomen, that all my lungs are restricted. I cannot breathe well. Get accustomed to do it, but it doesn't matter. They hyperventilate. They have the obstructive sleep apnea. And then you ask them, do you snore in the night? No. And the wife, we cannot stop him. You know, it's these problems. Then we go to the liver that becomes fatty. The gallbladder becomes sick, dysfunctional. There's GYN problems, mainly infertility. We see a lot of infertility women that want to get pregnant but can't because of their weight. Osteoarthritis. Recently, the Society of Orthopedic Surgeons has stated that nobody with a BMI of 40 should have a knee replacement. They should go first for weight management and then for knee replacement, because it's a waste of money. They will come back with a problem. Our joints were not designed to bear that.
Doctor, I want to talk about that, doctor. Pain in obesity, doctor. We as practitioners know we get all these patients that come in and they're like, my back hurts. Give me a shot, give me a pill. And then everybody writes Tramadol. We know the opioid epidemic. Okay, stop writing Tramadol and Tylenol number 3 practitioners for your patients. Okay, tell them to lose some weight. My knees hurt, I can't walk. So you're gonna get a knee replacement, but you weigh 200 pounds. Or, you know, all the pains, like my back hurts right now. I'm still too heavy. I mean, my knees were not meant to carry 170 pounds. I'm 5'3". Okay, so doctor, tell us about pain and obesity. You're saying about this patients that have a BMI of 40 are not supposed to get a knee replacement because they're not going to have good outcomes. Tell us about the relationship to being overweight and pain. Sorry guys, nobody should get offended. I'm just as heavy as you are. We're educating the community, okay? And yes, we have to get down to our ideal body weight as close as possible. Tell us about the pain, the joints, and the relation to obesity, doctor.
Yeah, there is no way that we can have a healthy spine or any healthy joints if we are just increasing our weight over and over again, where the bones are, the friction of them are increasing. Our back, which unfortunately because of our activity, sometimes we have some small bulging disc. Well, the weight will make it worse. But as an overall, and just to continue with this, the skin has to suffer because of some inflammatory changes that we're going to talk a little bit about. There's more propensity for the gout, which causes the pain. Phlebitis, which is one of the problems with wound care, that there's venous stasis, so the veins don't drain appropriately, and that causes a lot of concerns. Cancer, no doubt that cancer is linked to obesity. One of the main ones that we see is breast cancer.
I'm very interested in that, Dr. Reyes. Did you say that cancer is linked to obesity?
Oh, yes.
One of the main ones is breast cancer.
Correct.
Wow.
We need to remember the adipocyte it's a factory of estrogens. And every single woman that increases their weight after the adulthood is at risk of increasing their exposure of estrogen to their body, to the breast tissue, and is associated with cancer of the breast.
Wow, guys, let's pay attention to that. If for anything else, let's not get some cancer here. Let's lose some weight.
So hypertension, problems with lipids, diabetes. There's not anymore a new term called diabesity, which is the relationship with obesity and diabetes, because the link is so strong, as Dr. Martin was stating. Coronary disease, cataract, strokes, a complete gamma of problems that even though we don't feel it, they are there. and they're increasing our propensity to become sick. Just think that sometimes we don't think. The fact that in the nights I am not sleeping well because my abdomen is so full of fatty tissue that is pushing into my lungs and is decreasing my ability to expand well, which is the hyperventilation syndrome or obstructive sleep apnea, that is increasing my heart burden every time I stop breathing. And then my mechanism of survival increases, drops my concern into my brain, and I start breathing again. And how many times a night is that going to happen? Well, it's about the many times in the night that my heart goes pumping very strong, because now I need my oxygen in other parts of the body. And if I stop breathing, my ventilation decreases, and then my heart starts in a burden every single night. And that will get me into congestive heart failure. And that congestive heart failure into liver problems, and so on. So one thing that happens because of my overweight is going to be a detriment to another organ.
Next. Sorry, we make Luis do everything.
So there are
we love you, Luis.
different stages in the wound healing that unfortunately are going to be affected by our weight. And most of this, what we see is that the inflammatory phase, the proliferative phase, where we want more vascularity, more oxygen, and the wound contraction or remodeling, where we're trying to scar, gets affected because of obesity. And this is where we are having problems when we have obese patients that need wound care. Can you do the next one, please? So when we talk about patients that are obese, it's a real challenge when we have wounds with patients like them. And we have had many patients with Ms. Lopez that are extremely challenging, because even though, as she said, well, I'm gordito, you know, I've been like that all my life, what's the problem? Well, the problem is that nothing works the same, and we have a lot of challenges with physical consequence of weight. So there's conditions that are called abdominal elephantiasis, where the pannus of the abdomen can weigh 300 pounds, just the pannus. So any wound is not going to be affected by vascularity or anything else, but just by gravity, the weight. You have a patient that has an incision, with that weight, it completely dehisces, it opens completely. The intertigo, that it is just two folds of skin close to each other, because my pannus is so large, and then we have fungal infection, we have ulcers, we have many concerns that, you know, we have to deal with. Venous stasis, and we're gonna see that is a major problem with our patients with obesity. And we have a difficulty, because even though we want to keep them dry, we want to keep them compressed, it is not as easy as with the patient that has a normal size calf. The poor vascularity with blood supplies of the tissue is also because we know that the adipocyte, it is not well vascularized, even though, yes, there's blood supplies everywhere, but the capillary growth on the adipose tissue is not enough to support the blood flow that requires to take the oxygen delivery and the nutrient delivery.
So doctor, if you have a patient that's obese, I just want to say it for layman's terms, so we're all understanding. If you're a patient that's obese and you develop a wound, for example, in your abdomen, what you're saying is because there's so much adipose tissue, there's going to be a delayed wound healing. It's going to take a long time to close, or it may not be able to close. Is that right? Because of all of the fatty tissue there. If you guys have ever seen fat skin, you can Google it now. Adipose cells, you could tell they're not good. Like there's nothing pretty about them. So there's no way those are going to stick together and granulate. I just want to make sure we're understanding that, guys. For all the clinicians, everybody watching, there's another reason to try to get to your ideal body weight. Thank you, doctor.
And this is where we have to be careful, because not the fact that we eat a lot means that we'll grow nourished. Deficiencies, vitamin deficiencies are also important, because wound healing requires a lot of factors that are important, and if you are not well nourished, there's no way we're going to be able to help you. So just one of the main things that we see here with Ms. Lopez is the chronic wounds that we see. There is lymphatic enlargement, because the lymphatics are not draining well because of our overweight. The venous stasis, there's the same, a lot of pressure into our intercorporeal central mass, so the venous system cannot drain appropriately. There's more venous stasis, which means the blood cannot flow, stays in the vessels, that leaks into the interstitium, and then the same blood that leaks leaves some pigments in the area that creates fibrosis. All that is a combination of disaster with lack of oxygen. It becomes dead tissue basically, and then it becomes an ulcer. So there's the position of heme in the tissues, there's fibrosis, and then all that contributes to the lack of oxygen, and not only to the creation of the problem, but the difficulty in solving. Can you?
Next.
So there are many, many, many problems, from small ones to larger ones. We have patients with lipomatosis of lipodema that just makes it more difficult, because these patients unfortunately also suffer on problems where they have the deposition of fat in certain parts of the body. And if the fat is in that part of the body, and that happens to be the area that we're trying to heal, it just becomes very, very challenging. So, needless to say, after I gave you all this bad scenario, I can give you the best scenario. And the best scenario is being well proven that 10% weight loss will improve significantly the comorbidities that happen with obesity. 10% of the total body weight. So if I'm 100 pounds and I lose 10 pounds, I'm going to reset my metabolism, improve my metabolism. So if I have 200 pounds, I need to lose 20 pounds. And whatever, as long as I lose 10% of my total body weight, I will start improving my metabolism, and we'll start, I mean, look at all these problems that can be improved just by losing 10% of my excess body weight. And it will better my wound healing. Now, how do we do that? In our practice, this is not just let's do some weight loss and that's it. We have seminars. We see the patients. We have a dietitian that will give education, because education is the main source of winning or winners, that we have patients that win with this problem. We have patients advocates. We work with Dr. Quintana to see that they're fit for what we want to help them with. It just can be a diet, it can be medication, it can be surgery, renal, pulmonary doctors. There's workups. You see how important venous doctors, because we want to see where the venous systems are before we do anything. Sleep apnea, smoking cessation, smoking. Nobody can emphasize how bad is smoking for us. Well, same to this. Obesity and smoking is a terrible combination, just like obesity and diabetes or anything. We do weight optimization, risk assessment, and then if needed, we do surgery. So this is the pyramid that we use to help patients. We obviously want them to be here in the lifestyle modification. We want to have the diet and physical activity. And diet is a way that I don't like. We have it there because it's just something that happens, but it's just not diet. It's healthy eating. Every time we hear diet, it's like, oh, this guy is gonna tell me not to eat something. No, no, it's not about that. It's moderation. We can eat a lot of things, and it's just the moderation is what we have to follow. Education, because unfortunately, it's fake news. We used to think that fat was the enemy. Now we know it's carbohydrates. So little by little we shift. We even professionals give information that is not 100% accurate, but thank God we improve. We continue to seek for better information to give you to improve your life. There's much better medications that we now use for patients that are willing to take that to lose weight. And this is also on why are we doing this? Well, because that's what we may be able to help the patient with. A patient with 25 to 27 BMI, it's just overweight, mildly overweight. 5 pounds, we can always help a patient to lose weight like this.
Doctor, is it important to even get involved in losing weight when your BMI is barely creeping up? Because a lot of people are like, I am not gaining that much weight. Patients tend to gain weight. Every year, if you gain a certain amount of weight, you're gonna end up with 100 pounds, right? 10 pounds a year in 10 years is 100 pounds. Yep. So is it important to address weight when you're barely overweight?
It's important to address because your lifestyle is what's important. And if today you start eating healthy, then in your older life, you're gonna continue to eat healthy.
Thank you, doctor.
Mm-hmm. And if you identify that going to grandma's house to eat tamales doesn't mean that you have to eat the 20 that she serves you in the day.
And she will serve you 20.
One is okay.
Grandma serve you.
Right. So patients that are overweight that they need to lose less than 20 pounds, yes, there are excellent medications for that can help you to lose that. And then if patients are more than 40 to 60 pounds overweight, we know that most likely nothing is going to work but surgery, and that's the reason why we offer sleeve gastrectomy, gastric bypasses mainly for the diabetic patients, and many other procedures, a big gamma of procedures that we do to help patients to regain their health. You were very right. When we help patients to lose their weight, they look good, they look better, but it's not about that. It's about regaining their health. So look at this beautiful woman. When she came to us, multiple medications, multiple problems, and now she's a different person. She had surgery, she was very successful, and we have, thank God, have many patients like her that had that benefit, and obviously that had helped us to improve the health of our patients. So going back to our concern about the wound healing, because it is a concern, it is difficult. What do we do right now in our practice? Obviously we have a big help with Dr. Farias because he's a wound care specialist. We have the help of Mrs. Lopez, that she's always there to see patients, doesn't matter what time of the day and time.
And then I text them, did you see 202? Oh my gosh, it's 1 in the morning.
Yeah.
You're awake too though.
Yeah, but I answered at 3 o'clock.
You're not awake.
But, so all these that we use is just a drop into the bucket of the mega problem that we have, because it doesn't matter. We try to keep the wounds moisturized. We try to do enzymatic debridement. We try to use some allografts. We try to use other devices like wound vacs that will help you to improve the care of our patients. But unfortunately, it's about prevention. Dr. Martin said it before. It's about getting the step not to get here. Or if I'm there, is to look for solutions. Because it's for me and for my family. I have had patients that come, and after we help them to lose 200 pounds, it's not about that they breathe better or that they can take less medications. It's about them going to the movie theater with their kids. Because before they couldn't sit.
Yes.
So it's a big, big improvement. And if we help patients, as you said, to get the information, to improve their lifestyle, to do healthy eating, to read the back of the products that we're eating to see what we are eating. That is where we have to start. Our kids, it's a priority. What we eat at home is what they're gonna learn when they grow. And if we have barbecue every weekend with 2 pieces of steak, that's what they're gonna teach their kids. And that is killing in our society.
Yes.
Mm?
I want to say something about not being able to sit. So this is always very interactive, very laissez-faire. And why? Because we're streaming it. I went all the way up to 280 pounds. Some of you saw me. My mother's here. I love you, Mom. But I went all the way up to 280 pounds. And I'm going to tell you, I couldn't fit. Okay? You will never understand what an obese person goes through unless you've been obese. I remember going to the Dodge Arena back in the day when it was the Dodge Arena, and I could not sit in that seat. I'm like, why did they make these seats for super skinny people? And that's when I said, and I literally had to sit through a concert a little bit sideways because I had so much pain on my legs. And people see me now, they're like, how did I get there? I was a size 4, everybody saw me, and then for 10 years of my life, I was obese. And you will not know what that is unless you've been through it. And we have to be compassionate, guys. People who are very busy, we tend to eat whatever, and we stay up at night, the cortisol levels, it is very hard not to fit into a seat. And that's when I realized he's changing people's lives because now they can sit. Now you fit. I like the recliners now that they made, but it's almost bad for us because they're super wide, so then you don't feel like you have a problem. You know? But that's when I realized we all fit in there. So what happens in this country, we make everything bigger. Guys, hay que concientizarnos del problema de obesidad. We need to have a consciousness of what the obesity problem is. And we need to be compassionate to the person that's overweight and obese because it's very, very difficult. I'm one of those that I eat one weekend and I gain 10 pounds. And I didn't even eat a lot. I just had 3 square meals. So we know that it's difficult, but it can be done. And you have options, okay? And compassion is very important. I just want to share that. Sígale, doctor.
I'm not going to take any more of your time, but I'd like to finish my talk with something that is relevant to what I'm talking about. And every now and then we partner with industry and we take from them knowledge, we take their things, and we sometimes don't give them a little credit of what they are, what they do. And this is, we use a lot of KCI products. It's a wound vac, which has been life-saving for many of our patients, she can tell you. And this is a very interesting story. I was just February talking with a surgeon that accepted this kid here in Oakland, California. 9-year-old kid playing in Iraq with his brother. They go into the field, they see a ball that looks like a ball to throw, and it's a grenade. The grenade explodes and kills the 16-year-old brother and leaves Calaf with an open wound of the abdomen, mangled from the hands, open from the brain, losing one eye. And he's obviously taken to the hospital in Baghdad, where there's nothing, there's no supplies, Basically, they told the dad, take your son, he's gonna die at home, just take him home. The dad refuses to do that and takes him to the air base, somewhere there in Iraq. The surgeon there, first of all, is like, well, I'm not a kid surgeon, this is a 9-year-old and he's gonna die. He calls people here in the United States, what do I do? So they start giving him some advice. After the third day, several surgeries, they still cannot help the kid to improve. So one of the surgeons that he's talking with is in Oakland, California, and she says, well, I will put a wound vac. Well, where's a wound vac in Iraq? So KCI flew a wound vac from, they found it in London, to Iraq, got a private driver to go through all the Warsaw and got a wound vac for this kid.
Wonderful. Yeah.
We don't hear those things. Cesar, KCI.
Cesar, come here real quick, Cesar. All of our vendors, we're gonna do a little live feed of your stuff. Are you allowed to come here, Cesar, real quick? With a brochure? Doctor, share with us what is a wound vac real quick. What is a wound vac for the people that are watching and how it helps us heal?
A wound vac is basically a sponge, a gray sponge that can come with antibiotic, with no antibiotic. And what it does is creates an atmospheric suction that allows the tissues, the swelling to decrease the pressure, allows the debris to be removed. And as an overall, I don't work for them, as I
Right.
disclosed at the beginning.
Yeah.
It's just that this is something that needs to be shared.
Absolutely, absolutely. Tell us a little bit about the wound vac and how we use it in wound closure. I'm gonna discuss it in a minute, but
Sure.
how does a wound vac work? And I do wake you up at 2 in the morning. Aren't you glad I changed my hours?
I am.
He's like, oh, you're not calling me at 2 in the morning. I'm like, no,
So-
I need to lose weight. So I started modifying it, doctor. Okay?
So basically, it's pretty simple. It does two main things. It deals with macro strains. So when there's open cell reticulated foam placed in the wound, it helps to, the macro strain is to shrink the size of the wound. And then the micro strain, it actually splits the skin cells, promoting granulation. So essentially it helps the wound get better a lot faster. And some chronic wounds will never be able to get out of inflammation without a product like this.
Now, guys, part of the reasons why everybody tells me, you need to do CMEs, you need to charge, people are going to show up if they paid for it. We get most of our patients by walk-ins, by referrals from colleagues like you guys. We don't do CMEs because I like to be able to share what works without people say, oh, she's talking about that because she's making some money. I don't need his money. I have my own money. Matter of fact, we have a thing. I don't like reps to drop me off. I can share a little bit.
Okay, thanks.
A little bit. We ask reps not to be taking things to our clinic. I have people here sitting that I work with all the time, and I've never asked you for a cup of coffee. Now, you make barbecue for me. I love you, Edward. But it's just because he likes me. He cooks for us. But the point is that, guys, we want to share with you what works. And this is an amazing story, doctor. Thank you for enlightening us. It's amazing. Because what we're here to do is we're here to connect. And can we change the world? From one little group that started here, guess what? I wasn't kidding about the patient in the Philippines. I have the pictures. I have the text. I have patients that I'm treating and not treating, reaching out. You know, I have patients from Reynosa that can't get here, and the daughters happen to be a nurse, so I give the daughter wound care orders, and they show me, I mean, ideally I'd have some debridement, but they're granulating. I mean, if anything, not our wounds will necessarily heal, but at least we want to give the patient comfort. And getting a bedbound patient's wound to not have a foul order, that's amazing. That's so humane for patients. So thank you for sharing that with us.
You're
Doctor,
very
what do you want to leave us with? Is there another slide on your thing? Or?
No, and the only thing, Cesar didn't know that I was gonna share this story with them.
And he didn't know he was
And,
going to get up there, but all
I-
of you guys are going to be on camera, so if you need
I
to
got
retouch your
it
makeup.
from the trauma surgeon from Oakland that made the process happen with the help of the industry. And we always, especially right now, hear that industry are thieves and they're increasing the prices and they do this and that. Well, every now and then some industry do the right thing.
Wonderful.
So thank you very much for having me here
Thank you,
in a Saturday. Thank you for
And doctor, tell us, I wish I had put your name here with all your stuff. How can patients reach you if they're interested in obesity help? Where's your office and your phone number? Dr. Luis Reyes, where's your office, doctor?
It's here in Lindbergh Avenue, 416 Lindbergh Avenue here in McAllen. And
What's the phone number?
the
We don't even
phone
know.
number
631?
6304161.
¿Está bien, doctor? 630-4161, Dr. Luis Reyes for obesity management.
Yes.
We're
and-
gonna we have the video, it's gonna be on our page, it's gonna be on our YouTube channel, subscribe to Lopez Family and Wound Healing Clinic YouTube channel. We are gonna be doing an interview with key people in the community. You're coming out whether you want to or not, because we're gonna do little short videos of stuff that you wanna know about, guys. You wanna know about him, you wanna know why it's important, and so thank you so much. What do you want? I want you to leave us with a thought. I want you to leave us with something you want them to take away regarding obesity and why we need to help.
Be healthy. Let's start today. Let's start today because especially for us adults here, if I don't buy it, my kids are not gonna eat it. So let's start us learning.
Very good point.
There's a 54210 program that has been started, and this is basically about 5 servings of fruits and vegetables, 4 hours of exercise, less than 2 hours of videos or
Screen
screen,
time.
and 0 sugars. And that is a program that has been proposed for our kids and for our families, but let's go, let's walk, let's be active, let's do a little bit of exercise, let's eat a little less, and let's just for our sake and for our family, and thank you always for our patients that always teach us a lot.
Thank you, doctor.